Hey everyone, welcome back to the channel. My name is Aryan Malik. I am a third year nursing student, and this is Study with Me series day 31. Today we'll be continuing our discussion on OB, and this will be the part 2 in the OB series. So, thank you for coming back. We'll be continuing our discussion as we were talking about how it is necessary for us as registered nurses to not assume a client's family definition or what they think of what family is. We need to recognize that how we may define family does not necessarily mean that the patient has the same definition. We as healthcare providers need to be broad and general, and we never make an assumption. Now, let's talk about the status of women in terms of maternity in the United States. Um, a statement which my professor made during the lecture, which really stuck with me, was the health of a woman in a country reflects the health of the country in general. So if there's a country where women are who are, and please, no offense, again, this is more like a general statement, and I'm not proposing my view on something. So generally, in a country where women who are healthy, educated, that country tends to be healthier and more financially stable. And the simple reason being because in many households and families, women make healthcare decisions like what the family is going to eat and what doctor will they go to, whether it's pediatrician or obstetrician. And when we in particularly talk about the United States, it's one of the only developed nation with an increasing maternal mortality rate, and something which is surprising is of the maternity mortality rate of which 60% are actually preventable because they are undiagnosed hypertension, undiagnosed diabetes, sexually transmitted infections, and if these are taken care of at an earlier stage, many mortalities can be prevented. And there is also an inequity based on the background of women. For instance, African American women are 3 to 4 times higher to die or to have significant complications in pregnancy by virtue of where they come from. Many states have actually actively started working towards this cause by starting many education programs that they're hoping will have better results in the future. When we talk about fetal mortality rate, 1 million fetal deaths at any gestational age occur in the United States. Now, a couple of key terms. Intrauterine means inside the uterus. Neonate means a newborn from birth to 28 days, and after 28 days, the newborn is called infant. Now, let's dive into female menstrual cycle and what happens due to hormonal activity. So, the menstrual cycle, it's basically consists of two cycles. First is the ovarian cycle. So when girls are born, they have millions of eggs called oocyte, which are present in an ovary. Every month, multiple eggs attempt to mature. Eventually, one becomes the most mature, and that is the one which gets released every month. Ovarian cycle is all about the ovary, and it is broken into several phases. First is the follicular stage or the follicle phase. it's all about the development of the eggs in the ovaries. So if a woman is born with million eggs, say 10 of them decide that this month we are going to mature and grow big, and they then try to get out of there, and they all start to mature during and eventually one of them will actually be the most mature. During follicular phase, multiple eggs are basically trying to get mature, and this phase ends with ovulation, meaning release of one oocyte. Remember, most women release one oocyte or one egg. Um, there have been like many instances where multiple gets released, and when multiple are released, there is a risk of twins or even triplets. Most women give birth to singleton, which translates to one baby. Singleton means one baby because only one egg is released. Now let's talk about two very important hormones, FSH or follicular stimulating hormone. It's released by the pituitary gland that stimulates the development of multiple eggs of the ovary. So, FSH, follicular stimulating hormone, the keywords are in the name itself, follicular stimulating. It's an hormone which stimulates the development of the eggs. As these eggs are getting more developed, eventually one is going to become the most mature. In order for this egg to be released, luteinizing hormone or LH from the pituitary gland is released that causes the mature egg to pop out of the ovary and then to enter the end of the fallopian tube, which is called the fimbriae, and then the egg begins its journey through the fallopian tubes to possible conception or development of a possible pregnancy. Ovulation is basically the release of mature follicle, and it only happens because of LH or luteinizing hormone. So luteinizing hormone in very basic terms is kind of like a push that says to the egg to go. In the female menstrual cycle, ovulation always happens at 14 days before the onset of the next menstrual cycle. A woman who has menstrual cycle that begins every 28 days means she spends 14 days in the follicular phase, she ovulates, and then the next 14 days. The more regular a female's menstrual cycle is, which is 28 days, the easier it is to plan or even prevent a pregnancy. Someone who has an irregular menstrual cycle, it becomes much harder for them to become pregnant, because if one month it is 36 days till they get their period, and then the next month is 32 days before they got their period, it is hard to pinpoint those 14 days when the ovulation or basically the release of egg will take place. I hope you found this video helpful. Please stay tuned for the part 3 that comes out tomorrow. Thanks for watching.